Hi, everybody. Lou Bernardi back again from Britepath to talk about a term today that we want to make sure is included in your glossary of health coverage and medical terms. It's really essential component of your health plan that really isn't discussed through plan documents or benefit advisors, insurance companies, and it's the concept of healthcare steerage. Healthcare steerage, as it sounds, is basically the healthcare systems steering members or guiding members towards low value care. They want to make sure that they are using their partners within the system to steer people into the system, into their own facilities, essentially casting a net over that care and trying to really do their best to let as little escape that net as possible. Think about fishing, I guess, as a term. So managed care is about leverage and profits. There's no question. Whoever has the leverage is controlling the profits. It's unfortunate, but that's where the motive is for health insurers, healthcare systems, and of course employers. Employers would love to be able to take some of that spend of their healthcare spend or health insurance spend back and reinvest it into their company, to their people, and generate more profits. And we can show them how to do that. So think about leverage. Back in the 80s and 90s, when managed care companies, HMOs, carriers with a network started to enter the marketplace, they were largely replacing indemnity style companies. Here in the East Coast, Guardian, Chubb, Home Life, US Life, these were the dominating carriers in the New York marketplace. They were indemnity plans. There were no networks. They competed for business based on their rates. Um, and a lot of it had to do with their reputation. Some companies just had a reputation for being quick payers, a little bit better administrative costs. So people were willing to pay a little bit more at that time for better service or perceived service. They were getting reimbursed based on usual and customary. If one particular company reimbursed higher and you were a white collar industry, you were probably going towards that vendor. You'd be willing to pay more for that perceived value. And maybe if you were a blue collar company, you weren't as concerned with the reimbursement level. You wanted to be able to deliver lower rates to your members. So the consumer had leverage. Um, the managed care companies entered the marketplace, and the consumer used their leverage to let the indemnity companies know, we don't like you anymore. You're going out of business. Managed care was definitely here to stay. They replaced the indemnity companies in pretty short amount of time, and it was because they could generate lower rates, lower premiums. The networks weren't super popular in the early days. The books that we used to walk around with weren't as robust as they are today. It took them time to grow, but they grew because the consumer loved the idea of the copay system and lower premiums. So the consumer's leverage really was transferred to the insurers. They were using the consumers as leverage, and they were able to go out into the marketplace, the healthcare system marketplace, and demand bigger discounts. The prices back then were pretty standardized. The insurance companies were getting discounts in exchange for patients, access to those members. They grew very quickly and they gained significant market share. The insurance carriers did. And this was a really big problem for the healthcare systems. The hospitals, which back in the day, most doctors, most facilities, most hospitals were independent. Not exclusively independent, there might have been a couple that were together, but nothing like we have today. They had big problems because their revenues were down because of the discounts, and they were seeing less patients. Some people were starting to go to other facilities, other hospitals, because of the networks. The hospitals that thought they were, provided greater value, they had greater reputation, we're now seeing less full status because people were going to the hospitals that were in the networks. So the hospital executives got together and said, we need to do something about this. We need to get the leverage. So they started to merge horizontally. If you have one hospital in a region among many, many hospitals, it's not as important for you to be in the network. But when you have 2, 3, 4, 5 dozen, 2 dozen, 3 dozen hospitals in a state or across a certain metropolitan area, it's really hard for the insurance companies to sell their product without those hospitals. So they did that because of increased their leverage, increased their ability to demand higher reimbursable fees, participating in network fees, and That meant the claims started going up, premiums started going up. And as a result, the plan started to deteriorate. Out-of-pocket costs for members started to go up because of the increased claims, because of the increased premiums, in order to maintain those benefits. So that was really the start of the out of control, out of pocket, and really the deterioration of benefits that started. But they didn't stop there. The hospital systems, those executives said, hey, if we merge vertically now with urgent care, outpatient, labs, radiologists, specialists, and then PCPs, imagine how much leverage we would have. So they did that. And now, today, 2023, a very high percentage of primary care doctors now are employees of the healthcare systems. So are the specialists, the labs, the urgent care, all of that stuff. And it's causing big problems. Not only are they using that leverage to get more compensation, higher reimbursement levels, they're also using that steerage of their primary care doctors and specialists to get people into the facilities that doesn't generate more value, generates more profits for the healthcare system. And because of the lack of transparency on prices, costs, most people find out 2, 3, 4 weeks later what it's going to cost them, especially if they have a high deductible health plan. It's a really big problem, but they don't care. They're not slowing down. They don't feel sorry for the out-of-pocket costs or the medical debt that they are generating. And in fact, the PCPs for the healthcare systems are loss leaders oftentimes. Primary care doctors aren't reimbursed, significantly high. The cost of running those offices because of the overhead, the real estate, the staff, all of that, it can actually lose money for the healthcare system. But the average primary care doctor generates about $2.3 million of upstream revenue for the healthcare system. And that's where the reward is for the healthcare system. They don't need to make money at the primary care doctor level because they're making it all of these other places. They're getting people into their beds. They're having MRIs, CAT scans, sonos, things like that at their radiology facilities, even though they can be 5 times more expensive than independent facilities. They're getting more people into the urgent care, the outpatient centers, and all of that. These PCPs obviously are referring. They're upselling because they're sending people to facilities where they generate profits, not higher quality care. And there's a lot of unnecessary care that's put into the system as well. So leverage, that is really kind of the centerpiece of today's conversation is, leverage isn't so bad. We think as these insurance companies grow, as they merge and take over other parts of insurance, as insurance carriers and pharmacy benefit managers are now starting to become the healthcare systems, it would be terrific if they use that size and leverage to lower cost, increase value for their members. But they're not doing that. Neither is the healthcare system. They are solely focused on profits. And at Britepath, we want these profits to be going back to the employer and their members. And we can show you how to do that. You need to be conscious of, you need to be aware of the healthcare system. You need to understand that the people, the healthcare systems and the insurance companies that are part of your healthcare and your insurance system are not aligned with incentives with you and your employees. So thank you for listening, and I'll talk to you next time.